I'm Ted Reinerson. I'm the medical director for the Separation and Loss Service, and I'm a stickler for time. I was born in a household with a father who taught us better never than late. It's pretty severe, but it has had an effect on me. So I like to start on time and keep our speakers on time as well. I wanted to begin by introducing Dr. Gary Kaplan, whom I've known for lots of years. Gary was a member of the House staff here shortly after I began the section of psychiatry in 1972. So I've been able to watch his meteoric career from starting on the House staff and now taking over as CEO of our medical center and bringing a lot of innovative ideas in terms of our development. So he's really saved the Virginia Mason Medical Center, and he's been very, very supportive of the Separation and Loss Service, which started here in 1984. So I wanted to introduce him so that he could welcome us to the medical center. Gary?
Thank you very much, Ted, and I'll be brief, but I want to welcome everyone to Virginia Mason. For some of you, it may be welcoming you to Seattle, and you may not realize that in many ways we are grateful to our hosts here at Horizon House and think of it in some ways as an extension of Virginia Mason, which is right across the street. And, but it's a real privilege to be here and share just a couple thoughts with you. We are so proud of this program, and as we at Virginia Mason work to make a difference in our community and beyond, this is the type of program that distinguishes us. As Ted mentioned, we've known each other a long time. He was one of the first people I met when I arrived here as an internal medicine intern 38 years ago. Ted was a younger psychiatrist who was leading a department that I think in many ways was not in the middle of a multi-specialty group practice focused on subspecialty care and technology and emerging as a great referral institution. But I think one of the things that Ted and his colleagues impressed upon all of us was the criticality of thinking about the whole patient, thinking about the whole family, thinking about the whole construct and environment in which people live and in which people heal and in which people bear the brunt of illness. And that stuck with me for a long time in my practice, which I continue to practice today. I think about those things often. We are proud at Virginia Mason to have stepped up on multiple occasions. Those of you in this community might be familiar with Bailey Boucher House, which is a fabulous example of stepping up when no one else would to provide long-term care for people with HIV and AIDS. And separation and loss is another example of that type of program. It's not, front and center on the profitability list. It's not something that is, deeply embedded in the medical model, and yet it is so important. So many people are forgotten who are second victims of traumatic loss, and we've been proud to support this program since its inception in 1984. And I want to thank Ted, and I particularly want to thank Jackie and Carl Merck, who have been, Jackie's with us here, who really were the inspiration for this program, not to mention the source of critical funding to begin the program and frankly to keep it going and to help us keep it going over so many years. So we want to give back. We want to continue to give back to our community, and we want to continue to distinguish ourselves as a medical center in ways that are different and make a difference for patients and their families. And this program is all about this. I know you've got a big day planned with some great faculty, and you're going to, I think, generate great dialogue and discussion. And I'll look forward to visiting with Ted and hearing the results of what will be a very meaningful day. So welcome. I hope you have a wonderful day, and I appreciate the opportunity to just spend a couple minutes with you. Thanks, Ted, for inviting me, and thanks to all of you. Thank you. Thank you.
It's important that we mention our co-sponsors, the Washington State Society for Clinical Social Work and the American Foundation for Suicide Prevention. And the American Suicide Prevention Organization has brought Jack Jordan out for the training, the full-day training tomorrow. They've been very supportive. I wanted to make sure that we not only acknowledged Jackie Merck, but Jackie, could you stand up for a moment so that everybody here in the audience recognizes Jackie and would personally thank her sometime during the day because of the tremendous support that she's maintained for our little effort here at Virginia Mason. The other person that I wanted to acknowledge was, and I think she's probably out working at the desk, is Laura Jeffs. Laura has been instrumental and very singular in terms of organizing all of this, and this training would not happen without her and the support of Laura Takas. Laura, could you stand up as well? Laura began working with us a year and a half ago. There she is. Laura Jeffs. Thank you again.